transfer objects here from hand to hand. Locomotion, movement. Babies start out moving in a cephalocaudal direction. That means their arms are stronger than their legs, and they push with their arms and they push themselves backwards. So they initially start by going backwards, and that's the 4 to 6 months. They push backwards using their arms. By about 9 months, they're creeping or crawling. Now, your book calls crawling where they use their arms and legs but they're dragging their belly on the ground, and then when they actually get up onto the knees and the elbows so the stomach's up off the ground, your book calls that creeping. I learned it the opposite way, where creeping is dragging the belly and crawling is up on the actual knees and elbows. I tried to look it up, and in one book, the two books I looked at, one agreed with your textbook and the other one agreed with the way I learned it. So I will never ask you to distinguish between the two on a test, because I'm not positive which the right answer is. About that same age, 9 months, this is where they can start pulling up to standing. So they'll grab a hold of a table leg and kind of hand over hand pull themselves up on it, and then hold on to the edge of the coffee table and stand up there. About 11 months they can start walking. If you're holding on to their hands, they're taking intentional steps, but they can't balance without holding on to you. By 12 months they should be able to walk holding just one hand or walk alone. And here's pictures of this baby. E is pushing himself, herself, whatever, backwards, using those arms but not really using the legs. And now in F, he's getting up onto the hands and the knees. And here we've got a baby pulling up, using a little table to pull up. And in A, the baby's able to hold all its weight on its legs. You know, the parent is balancing him, but it's not until D, which is about 10 months, that he's taking intentional steps, trying to move with steps, but still has to be held, can't balance. Okay, psychosocial development. This is trust versus mistrust, our Erikson stage. So what they're doing is they're acquiring a sense of trust and overcoming a sense of mistrust. So the trust comes by feeding, comfort, stimulation, and caring. Whenever they have needs for that, those needs are met, and they learn to trust that those people are going to take care of them, that when they need something, that need is going to be met. Mistrust happens when the parent and the infant, they don't learn to meet each other's needs. For whatever reason, the parent doesn't feel loved from the child doesn't have its needs met from the parent, and they never get to a point, the infant, of trusting that when they need something, it's going to be taken care of. When their trust is developing, they are having their needs met, they can start to learn delayed gratification. So they know when they're hungry, mom will come and feed them. And it used to be immediate, and now it's starting to take a few minutes, but because mom has always come and fed them, they trust that it is going to happen, even though they're a little older now and mom finishes her meal before coming. And they get to that point through consistency. They have to have their needs met all of the time, not just some of the time, to be able to trust that, okay, mom really is going to come, because she always does. And at this stage, they really like tactile stimulation. They like to grasp things. They like to bite things. And one of the first real conflicts they might have is learning to not bite mom. It feels good to bite, and they like biting, so they bite. They can now, put things into their mouth and bite them, and that's good. And mom picks them up, so they bite mom. And mom scolds them and puts them back down. And they have to come to terms with, If I want mom to hold me, I can't bite mom. So it's kind of the first time they have to find a way to resolve conflict. Okay, cognitive development. This is Piaget. He says they're in the sensory motor phase from birth to 24 months, so they're using their senses to explore things. It starts out with reflex behavior, and then to simple repetitive acts, and finally to imitation activity. And some of the things they have to do is learn that they are separate from others. A tiny infant, when he cries, mom responds. So is mom the same as him? Mom responds to him. It takes a little bit for that child to realize mom's a separate person. Mom doesn't have to respond when I cry. I don't control her. So that's learning that separation, that they're separate from others. Object permanence. This happens around 9 to 10 months. Prior to that, if the toy is dropped and the child no longer sees it, they have no idea that it still exists. It's out of sight. It may not exist anymore. Around 9 to 10 months, they realize if I look over the edge, it's still there. I can find it. And then they start being able to use symbols and mental representation, so they can think of an object. Even though mom's not in the room, I can think about her and know what she looks like, what she is. And here's a picture of this child's developing that object permanence because she's looking for something that's hidden from her. And babies love mirrors. Mirrors are fun. Social development. Between 6 and 12 months, they really start to be attached to the parent. They start to know who their people are and who their people aren't. And this is where you get stranger anxiety and separation anxiety. 4 months, babies start laughing. 6 months, they really have a lot of personality. Reactive attachment disorder. This is what happens when kids, especially kids who have been in some sort of an institutional setting, an orphanage sort of thing. They've never really had their needs met. They've never attached to someone, and this can lead to lifelong antisocial behaviors, mental illness kind of problems. Around 6 months, I was saying you get that separation anxiety starting. 6 to 8 months, this is where babies who have gone to strangers all of a sudden won't. They know these are not their people. And during this age, really during every age, play is part of how kids learn all of this. And play is important. But help parents or remind parents that play doesn't mean providing toys. Play requires interacting with the child. And here's a picture of some attachment going on. Language development. Initially they start with crying and develop different types of cries, and then they start making some of the vowel sounds followed by some consonant sounds, and it's predictable what sounds they'll do first and next, except for maybe some of the first consonant vowel combinations are mama and dada, and that may depend on who is saying mama and who is saying dada to them the most. But those are some of the first sounds where they start combining the vowel and consonant. By a year of age, they ought to have 3 to 5 words that they're saying with meaning. They're not just going da 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 da. Every time they say da da, they mean daddy, and every time they say baba, they mean bottle. It may be words no one else could ever understand, but they say the same thing, meaning the object that they're thinking of. Again, this says here, play with the child. Don't just provide toys. I don't know how that got in 2 places. There is this chart on page 336 through 341. This chapter has a lot of memorizing in it. This is the first part. Memorize these growth and developmental milestones. The ones that have a little black square next to them mean they're the important ones. You have to master that skill to go on to the next one. So you have to first have your vowel sounds before you can get your consonant sounds. Some of them don't have to come in a specific order. The ones that are the most important are the ones with the little black square in front. Those are the ones I want you to memorize. Okay, limit setting. Help parents, especially when they have a sick child, this can be hard, to set limits. Children need to know certain things are no, certain things are not safe, and they're not allowed to do them. You can start fairly young with timeout. For a small child, timeout in the playpen is really appropriate. As they get a little older, they can do timeout in a chair. If you wait till a child's 5 or 6 and try and all of a sudden introduce the timeout chair, they're not going to stay in it. So it really is better to start this younger, but you have to make sure, that was the earlier effective discipline, the earlier it's employed, the easier it is to continue. The next thing says that infants don't understand cause and effect between objects and physical harm. So they're not trying to touch something they shouldn't. They don't understand that the hot stove burner will burn them. So we have to make sure we're keeping the environment safe for them. And one of the other concerns is always shaken baby syndrome. A baby should never be shaken. Their brain is large, their neck is not strong, it wobbles back and forth, and their brain slams back and forth inside their skull, and they can have major brain damage. They can die from being shaken by a parent who's just at their wit's end. So the rule of thumb generally for timeout is a minute of timeout per year of age. So a 1-year-old, you can only do a 1-minute timeout. A 2-year-old, you can do a 2-minute timeout. And small children, it needs to be immediate. Timeout, after dad gets home hours later, they no longer remember what they did. So it needs to happen right then in order for them to connect the two, that what they did is